Hi, this is Kevin with Garrison Dental Solutions, and today I'm lucky enough to be here in Beverly Hills, California with Dr. Matthew Nejad. And Dr. Nejad is going to take us through some of the tips and tricks to deal with deep margin elevation that he has been working diligently to develop this beautiful technique, and he's going to share some of that with you here today.
Hey guys, so as mentioned, I'm Dr. Matt Nejad, and I'm very excited to share with you some of my experience and technique of the margin elevation procedure, which is something that I think has a lot of potential to expand our conservative restorations, minimizing the use of crowns, because a lot of times people go towards crowns when we could have still been doing more conservative biomimetic restorations. So I'm going to give you a little bit of a breakdown on the procedure, when to use it, and how to have better success with it. So behind me over here we have a typical example of a deep carious lesion that extends closer to the crest of the bone, and typically this would be something that is slated for crown lengthening and oftentimes a crown by that point. And instead we're going to do this margin elevation technique, and this is what it looks like after it's completed. So basically the concept is that we can elevate the deep margin with composite on the preparation day, then come back and cement with a indirect inlay or onlay restoration. And there's a lot of arguments against the two restorative margins and so on, but the reality is that there's only one margin that's going to fail in a restoration like this, and that is the margin to the tooth structure in the gingival margin area, which in other words is this margin right over here to the root surface or the dentin cementum. And the better we can make that margin, whether it's one piece or two piece, the better the success is going to be. And the whole point of this margin elevation technique is that we can get the best isolation and do this in a relatively time efficient manner during the preparation appointment with this technique, whereas if we're trying to cement a deep restoration, it's very difficult to get this isolation for the duration of the cementation procedure. So the reason that these localized subgingival margins are typically a problem is that they complicate due to isolation. It's very difficult to keep them isolated, whether it's during the preparation day, impression taking, or even during cementation visit, where it's very important that we keep good isolation if we're relying on adhesive retention. So here we have this case, and this is what it looks like. And first thing I do is assess, where we're at, clean out, and then I like to get some isolation in place, whether it's Isolite or rubber dam. And my goal is to now do a deep margin elevation, because there's so much tooth. You may look here, there's so much tooth intact that I want to restore this without doing a crown. And I also always like to discuss with the patient that, hey, you can get a crown lengthening procedure, or we can attempt this procedure and you can always get the crown lengthening later. And my experience has been that most patients are very likely to forego the surgery, and my experience has also been with the right technique, good isolation, and with the right results, we never need to go for crown lengthening procedures in these cases if we can get the right margin, seal, and results. In an article by one of my mentors, Pascal Magnier, they discuss the technique and the requirements to do the procedure correctly. So first thing is, if we're looking, we need to get a matrix band that adapts very, very well to this deep margin over here. The problem with typical matrix bands is that as you tighten, they meet resistance at the height of contour. So they get as you tighten, they get overly caught up in these areas and they don't form a seal in the gingival. By having a matrix band that's shorter in height, it has a tendency to pull itself down lower and lower on the tooth and give a better adaptation. So key number one for the technique is you have to have the right matrix band. Before using the matrix band by Garrison, I was cutting matrix bands and customizing them, but I realized that was a very inefficient, time-consuming step, and I came to Garrison and I asked them to make this, and as demand grew, they were able to accommodate that request. So now we have two different options for this technique. You can use the standard matrix band here that's been customized, so it has this shorter section which kind of adapts like I just showed you, and then you can use it with a Tafelmeier, or you can actually switch systems and use the ReelMatrix handle, which has this nice plastic reel. And what I like about it is it's not bulky, it has a low profile, and it doesn't have the same weight of a Tafelmeier, so it doesn't tend to want to slide or fall off or move during the procedure. Same case I just showed you, this is after isolation and cleaning the margins. This is the matrix band in place, and it's very important to notice that in the center photo we have very, very good isolation. A prerequisite to doing the margin elevation technique is that you have excellent bonding and excellent isolation. Then we go ahead and we do the steps that I normally do during a preparation procedure, including immediate dentin sealing, where we seal the dentin. It gives us the best bond and the best results for the cementation visit and the long-term success of the restoration. And we do those steps, and then we elevate with several increments of composite. I don't do it in one big bulk, and I don't use Flowable. I like to use heated composite. My favorite is APX by Courare, and I do it in 1 millimeter increments. So on average, we're doing 2 or 3 layers. We're not trying to do too much, because if you bring this higher and higher, then your final restoration is going to have a very difficult time of having good contour. And if we stay too low, then we have the isolation issue. So the sweet spot is to get something that is either equigingival or 0.5 millimeter sub or supragingival. We're not actually trying to go over the top high, and we also don't usually end up at around 1 millimeter. I've noticed 2 millimeters is the average, sometimes 3. This is after the completed margin elevation, and this is after the completed cementation. In this case, I also had an area where I did a separate composite restoration. And this is the absolute completed restoration. And then when you look on the radiograph, you can see what the final biomimetic solution looks like. So we have our onlay, we have our margin elevation here, and the separate filling over there. And this case I've been following up for almost 5 years now, and I have other cases going on 7 and 8 years. There's, in the literature, there's reports going on 12, 13, 14, and so on. It's a very good technique, and as far as a lot of the concerns, including biologic width invasion, my response to that is, we're all able to assess what biologic width invasion is. It has to present with inflammation, deep pockets, bleeding on probing, and all these other factors, and biologic width is an average, so not every patient is going to have the same biologic width criteria. So my suggestion is try the procedure when in doubt, measure the results, and it's never too late to have the patient go and get an additional procedure. But oftentimes you can spare procedures with the right technique, and everybody wins with that. Hope you enjoy this technique. It's really an awesome part of my practice. I don't use it every single day, but when it comes in, it makes for a lot of interesting results and a lot of happy patients. Reasons for doing the margin elevation is you have a subgingival margin that you think will be difficult to isolate during delivery, and if you can't isolate it, you don't get the right bond, and then you're suffering the long-term success of the restoration over something that we can handle on preparation day and make it simpler. So this margin right here is the problem, and what we're going to use for that is the margin elevation band, and we're going to be using this ReelMatrix version of it. It comes in 2 different versions. If you want to use your Tafelmeier, you still have that option, but the benefit of this is it has a nice minimal package, small footprint, stays out of the way, it's not heavy, so it works really, really well. The idea with this band is that we can place it around the tooth, and the narrow aspect of this band, the way that it's cut so that it's not very tall, makes it so that it's very efficient at going down further on the tooth. Instead of getting stuck higher and higher up here and not working its way down, it's really good at getting these isolated deep margins down there. So what I always like to do is figure out which side I'm going to be coming from. So here, buccal makes the most sense. You can come straight buccal, you can go towards the distal or the mesial. I usually say straight buccal or opposite corner of the margin that you're trying to elevate. So coming a little bit from the distal gives it a nice tension. So when I do that, then I want to make sure I line up the ReelMatrix handle so that it has a good path of insertion or access. You don't want to be fighting the cheek or anything like that. So let me get that set up. Now how this works with the ReelMatrix handle is you have a nice little area here where you pull and it releases these arms that will grab right into the ReelMatrix, and you insert it in, and then you can pull back on that ball, and then you have it nicely positioned. So now as I come in, one of the key things is that you cannot tighten and loosen the band repeatedly without creating problems, okay? So what I do is I don't try to tighten right away. I try to position in the right place, then start tightening very cautiously. If you have to unwind, it's probably best to go back and change the band because it starts to unwind. Same thing applies for a Tafelmayer too. You start unwinding a Tafelmayer and things start really falling apart. So right here, if I start tightening, you'll see that I'm pinching gingiva. So my goal is to try not to tighten too much until I get the matrix band between, just like that. And then I can either use a finger, a handle, or an instrument while I start tightening this by turning it clockwise, little by little by little, verifying the whole time that I have a nice, good adaptation. And once it's pretty tight, I'll give it just about another 1/4 turn. And now if we look back over here, I can release the tension by pushing forward, let go, and everything is in place. Let me try to give you another view of this. We have a really, really, really good adaptation of this mesial margin. I typically do this with rubber dam in place, but I've also done a lot of cases where you'll get really great isolation even with something like an Isolite or other isolation method. The idea is once you have this matrix band and it's really, really tight, no moisture or saliva will come in between your margin and the tooth. It will maybe have some areas of saliva pooling or bleeding on the outside area, but it's rarely ever a problem here. Also note that you cannot wedge on a deep margin. If you wedge this, you're going to create a really weird contour that pushes the matrix band over, creates a weird contour. So instead what you want to do is use the band and tighten it. And if you need some extra tension, you can always pack a piece of super floss, Teflon tape, or cord on the outside. But in this case, we don't need anything. Okay, so say you did have a little bit of a gap, like especially on a figure 8 or like root concavity area, you can pack Teflon tape on the outside and it works really well. Or alternatively, you can try super floss. So what I do with super floss is I take the thickest spongy side and I come in here and I floss it right between, and the tension just holds everything together and it acts like a little mini wedge to tighten that area. I only really have to do this in rare cases where I still see a little bit of moisture coming in just to get that final seal. And then we can actually proceed with doing the margin elevation technique. And if you think about it, the thing is, like, while you're doing this, you need to keep good isolation for about 2 or 3 minutes so that you can build up and seal this area. Once you've done that, there's really no more issue with contamination going on. But if you are cementing a deep restoration, cleaning your cement, usually you have a longer window of time that you need to maintain isolation, and you generally don't get the same quality of bond and seal in this area because you're fighting moisture while you're cleaning up cement and bleeding's going on. So the advantages of this technique are you get a perfect bond here, and this is really known as the most common bond to fail, the most difficult to isolate, the lowest area of bonding. But when you do the margin elevation technique, you really tackle a lot of those problems head on by being proactive about it. Now at this point, we're ready to actually do the margin elevation procedure. And this is where it's important to remember that not all materials are created equal, and there's a whole science of adhesion, which I teach in my courses. And what we do on the prep day for an indirect restoration like this is we actually not only will elevate this area, but we'll seal all the dentin surface, and that gives us the best bond, best success. It's just a totally different paradigm. It eliminates lots of the problems and gives you like the best maximum adhesion possible to dentin. So it's called immediate dentin sealing. So what I'll do is, if you look at this right now, we have dentin or cementum all the way up to this margin, and then we have our enamel going around here and up around on the buccal, but everything else is dentin surface. And what we do is we apply our dentin bonding agent on that day. Again, they're not all created equal. I recommend a couple different systems, my favorite being SE Protect by Curare. So that's what we're going to do. This is a self-etching primer. So I bring this self-etching primer over right now, and we start scrubbing all the dentin surface. And what this is doing is it's etching and eliminating the smear layer, and it takes about 20 seconds to scrub it in. It's compacting the smear layer, I should say, and it's also priming. So as we do this, we do it for about 20 seconds, get everywhere, especially in this deep box area. It's okay if you cross the enamel area, though my major goal right now is to just seal all the dentin. And then, because in this system the solvent is water, it's very important to air dry for a solid 10 seconds to completely evaporate all that solvent. So I'll count to 10 as I'm doing this. And with the adhesive now, it's a little more important that we stay isolated onto the dentin. If we get too much on the enamel, we'll want to go ahead and clean that off, because we want to have a nice clean margin for our final impression. So you can either be very careful now as you're applying it, or you can go back with a burr and try to clean it up. I usually prefer to apply this very cautiously. So I'll take my adhesive, apply it to the center, work my way forward to the margin, which is fine, but as I come to the enamel, I'm a little more careful to just come up to the DEJ area, going past it just a little bit, but not all the way to the margin. Okay, and then my goal is to have the thinnest possible layer of adhesive, and then follow back with what I call the best adhesive, which is flowable. So after you apply this, what I like to do is dry my microbrush off, or just grab an entirely new microbrush and come back and wick up the excess. But if I air dry, it would make a mess, introduce oxygen, and there's a whole bunch of other variables. So I don't want to air dry, I just want to remove the excess. And then I'm going to go ahead and cure that for, we're going to cure that for 20 seconds. So at this point, we would say that's called immediate dentin sealing. And while we're talking about the margin elevation, we can't perform this without combining the two, because the whole goal of doing these types of restorations is maximum bond strength. That's what makes them last the longest, perform the best. And if you do the margin elevation technique and you're not having the right bond, it's going to inevitably fail, and you're going to blame the technique, which is definitely not the problem. We need to have maximum adhesion. So now I'm going to do this flowable. And what I'm using here is Majesty Flow by Curare. It's a very highly filled flowable. I like the properties a lot. I highly recommend it. And what I do is I apply just about half the surface with the flowable. Then I use a probe and I level it off, and I'm covering all the dentin surface here. And this is something I cover in my course, so go ahead and check that out. The website's going to be on this video. And what we do is, as we come to the mesial, I don't want a large pooling of the flowable, so I just drag a little bit right up to there. And if you find you need a little more flowable, you can add that. If you find you have too much flowable, you can remove some of it. It's really not too difficult to manage, because this flowable is really nice. It doesn't slump very much. It's got really good properties. Probably just a little bit more, and again, use the probe to drag it down. Really good for smoothing your prep. And you don't want it to be too thick, so what I do is I just check with my probe to make sure it's less than a millimeter everywhere. It could be as little as 100 microns and as high as half a millimeter. Then we cure again, and this is part of the immediate dentin sealing, but I call it resin coating. And the important thing to realize is the whole time that this adhesive is curing, the bond strength is improving better and better and better, but there's really nothing to stress the bond while it's forming. Whereas when you go to cement and inlay or non-lay, you have the competition between the cement or the resin trying to shrink towards the restoration or towards the tooth. It's pulling in both directions, and it weakens the bond a lot. Here, there's no competition. Things are all forming nicely. Now we're ready to actually elevate this margin. It's like the final step of my immediate dent and sealing process is to elevate this, and my goal isn't to overly elevate. I just want to elevate this margin so that it is equigingival or 0.5 millimeter sub or supergingival. My only criteria is that when I go back to cement, I'm able to isolate this predictably without having contamination from bleeding, saliva, or anything else. If you overdo it, you increase the chance of polymerization stress problems, and you make it more difficult for your final restoration to have an ideal contour. So really nice to make sure you measure. Here I'm just going to go for exactly equigingival, and most of the time the margin elevation is about 2 or 3 layers. And that means 2 or 3 layers of 1 millimeter. So I do this in increments. I don't bulk fill it. I do 1 increment at a time. And what I like to do is measure the composite on my gloved hand. Let me show you how I do this real quick. Okay, so here I have some composite right over here. And what I'll do is I'll just cut a piece of it, roll it into a small little sphere. Even that's just a little too big. That's better. Okay, then I'll bring that right into this area here, place it in, and then I like to use a micro brush to pack that down. I also heat the composite. So here I use the Calcet warmer to heat it up, and there is a couple studies on that show that it gives the best adaptation, best seal, and best mechanical properties. You do not want to use Flowable to do your whole elevation. Even though it would adapt well, it doesn't have the right properties to give you the best durability and long-term success. We're going to cure that increment just about 10 seconds because I have another increment to do. So that's increment number 1. It's about 1 millimeter. And like I said before, usually we're dealing with 2 or 3 layers, which means your elevation on average is 2 or 3 millimeters. So I'm going to repeat that same process one more time and come back with another little sphere of material here. There we go. And sometimes you'll roll a little bit over this matrix band. Also, you can position the matrix band a little higher. Clinically, it's very, very uncommon that your matrix band will go too low. On a Typodont like this, because there's really no resistance subgingival, you can actually place the matrix band a little lower, but clinically it's very, 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 very uncommon to be able to have the matrix go way too far down. So right here I'm equigingival. If my composite rolls over, that's fine, because the last step I can always finish this margin with the burr. I do try my best to minimize that. And once I have that just like this, we'll go ahead and cure that. There's one area I can smoothen right here. So you see micro brush is a really nice instrument for this. Okay, and then to smoothen things off, you can just for purposes of your impression, you can do a little bit of adhesive just on top here to smoothen out any roughness. And when I go back to cement my final restoration, there's a whole protocol that involves air abrading this surface. So a lot of this adhesive will be removed, but for the purpose of the impression, it gives us a really nice impression. Okay, so this would complete the margin elevation. Now I'm going to show you that. There's one more step that I would do before impression, which we're not going to demonstrate, but I would cover this all with glycerin to remove the sticky surface. It's called the air inhibited layer. You definitely want to do that before your impression, or you'll have it kind of creating creases and folds in the impression. And if you're scanning and you're applying powder or anything, it'll stick a lot more. So last step is always to remove that air inhibited layer. Then we come and we're ready to remove the matrix band, so you can get rid of your floss at this point. then you can take off the matrix band. This is the example of why unwinding doesn't work very well. So as I start unwinding, oftentimes the band will start slipping and having a little bit of loss of resistance here. So let's do that. You'll see it coming out. Then we'll lift it right out of place. And taking a look and evaluating these margins, the goal for the technique is to have no finishing except for 12 blade or finishing strip right in this corner. I recommend 12 blade. You just take a sharp blade and you just kind of run it right through this margin here and on the buckle, and remove the flash of material, and that's it. That way you get the smoothest surface of the resin against the gingiva, because the matrix band surface gave it like a perfectly smooth surface. We want to avoid going back. We can't polish to that level, so we just want to remove the excess. That's why it's important when you're applying the band to get a good seal. Use Teflon tape, use whatever you need. Now when I come back to cement this, if I use rubber dam, I get that 0.5 millimeter of retraction I need. If I use cord, I get that 0.5 millimeter of retraction I need. I'm confident I can deliver this restoration without having any issue keeping good isolation. That's the margin elevation technique. It's very useful. I teach it in my course. I think it's something that has grown in popularity. There's a lot of research and science that supports it now, so it's something that you can kind of throw into your bag of tricks and techniques to do more adhesive dentistry, more conservative options, and avoid crowns. Thank you.